Hey, welcome into Wisecarver Solutions, weekly Medicare Basics podcast. And so this week, I wanted to let you know that I had an interaction. We had a great conversation. I knew kind of right away that I wasn't going to be her agent, and just some things indicated that right away. But I know that I needed to help her. And then as we uncovered a lot of things, realized that man, somebody got her into a plan. They were solving one issue, but exposing her to vulnerability of could be tens of thousands of dollars, which is not at all what she expected. She didn't understand. I don't think the agent before that helped her really understand the full capacity of ramifications of what they were doing, trying to solve this one little problem. So it's really important who you have as an agent. And again, this is I'm just divulging this because hey, this is what I do. This is how I do business. I'm a kingdom person. I'm a person of integrity. You can trust me. As much to my ability, I'm going to help you as much as I can. And even if it means that um, I can't, I'm not going to be your agent. I'm still going to help you as much as I can as well. So I just want to throw that out there. All right. Well, who is this for? This is for anyone who is a Medicare recipient already. Maybe you need some clarity, some education, a little bit. That's fine. You can always ask any questions below. I'd love to answer any questions. Also, you might just be looking for information because you are support to a loved one. Maybe your parents are turning 65, or if you're turning 65 yourself, you may need just doing general help. So definitely connect with me and I'll be able to go over things in more detail on a one-on-one basis. So let's get into it. This incident, I want to describe exactly what happened. So basically, I was just doing the normal assessment, and basically say, what are you? Make sure that you're eligible. We go through the thing, the Medicare compliance things that we need to do, and then get through that and talk about their medical um, needs and what they currently have. And it actually took quite some time to understand that they had Plan F. This was a supplement plan, and but they currently, and just because we're just out of annual enrollment period, it's the middle of January, and so they're in a new plan to solve a prescription drug issue. So typically, when you're on a prescription drug only plan, you pay for this plan. It depends on the area and stuff, but it could be $50 to $100 a month, and you might not even use that plan. Meaning the medications that you're using, you may have like a good RX or discount or something like that that actually gets you a better discount than the actual plan itself. The plan has a formulary, and it may or may not include that specific medication. So she was in just kind of an anomaly where her medication just wasn't covered, and so she was paying out of pocket for the med that wasn't covered by the plan, and she's paying for the plan because you have to have a plan. That's Medicare rules. You got to have a plan to cover Part D. Otherwise, you have a late enrollment penalty for not having coverage. So the individual that got her in the plan solved the problem by getting her into a Medicare Advantage plan, which is an all-in-one. That is basically means that you have to have A and B to qualify, and the plan covers those medical things, hospital and normal medical, as well as other benefits and prescription drug coverage. Each Medicare Advantage plan has a formulary as well, and some of those include more, just as the way that it works. So her plan, her new plan covered her medication. She was going to pay $0 out of pocket, and she didn't have to deal with the deductible for prescription drugs as well. So she was in a really good plan as far as that goes. And so that's why she was in the plan. Well, here's what happens when you have a Medicare Advantage plan versus a Medicare Supplement and a prescription drug plan. You have to have, like I said, A and B in order to qualify for a Medicare Advantage plan or a supplement plan. But a Medicare Advantage plan is a private insurance plan. It's through the private insurance company. And so you no longer have A and B working. It's basically a requirement to get into the plan. And now this takes place of Medicare. So this, and we discovered that she was in Plan F. This is a supplement plan. Plan F is a plan that you can't actually get into anymore unless you had eligibility between prior to 2020. You just can't get into that plan. It's one of those grandfather, type of plans. So she was like, oh, I'm never going to lose my Plan F. And I'm like, but you have a Medicare Advantage plan. This takes place of that plan. So legally, you go through one system or the other. You go through Medicare system A and B, and your supplement closes that gap, that 20% gap that you would have responsibility for. Um, that so it actually works with A and B. Your supplement plan works with A and B, right? So you give them all of your cards when you go to the doctor, instead of a Medicare Advantage plan, which is its own thing. And so, because there's two different systems here, you can't use both. So, whenever you sign up for a prescription drug plan or a Medicare Advantage plan, it automatically cancels out the other plan, right? So, but because she signed up for a Medicare Advantage plan, her prescription drug plan canceled. But I believe she still had the supplement plan in play, and she thought she still had that. And so, because we're in the first month of being on this new Medicare Advantage plan, the solution to me was like, okay, just call Medicare directly and let them know that you um, basically were solving for a prescription drug issue. Um, but she never intended to get out of her Plan F supplement plan. So she was upset, of course, and I'm like, hey, this is why I'm telling you all of this. It took a while to kind of let her know what exactly was happening. So, oh gosh. Anyways, yeah, I wasn't gonna get off that call unless I knew for sure she knew how to handle that going forward. And so yeah, it took some time, but that's just how I am. I'm just gonna make sure that I basically treat everyone like I'm my mom's agent now, which is pretty cool. She didn't have an agent before. She's just been solving her problem herself, and so now that I'm her agent, she has somebody that she can kind of lean on and help her walk through all of this stuff. And so I basically treat everyone as if, same amount of effort as if it's my mom. So I'm going to do everyone right, even if I'm not your agent. I'm still going to treat you that way. So, anyways, I think this is really important to vocalize because I keep seeing these types of things where I uncover and kind of let people know, like, oh, hey, you're this isn't optimal for you. This is problematic. When somebody else solves a problem, especially when it's like a prescription drug issue, and then they get them into a whole other situation, and so I just feel compelled. I need to educate them and let them know. And oh, geez, so those things are very important. It matters who you have as an agent. If they couldn't adequately explain all of that to you, yeah, you might need to call me. That's okay. My cell phone is 360-846-8200. So if you have any questions, you want me to talk directly about any specific thing, please let me know. I'd be more than happy to. The bottom line here is Medicare doesn't have to be complicated. And if you have somebody that you can lean on to kind of shoulder the burden of, knowing and explaining things and solving problems, one of the things I like to do actually is solve the problem of, the assessment, figure out what plan is going to serve you, that kind of thing. But also throughout the year, be a support to somebody, and kind of shoulder kind of that burden, like I said, because things pop up throughout the year. There's complications. Some people get moved into a plan we don't know how or why, and so we need to solve that problem, figure out what happened, and those kinds of things happen. And sometimes you get a bill that it's like, wait a minute, I don't think this is correct. And so if we need to dispute it, then you have some help that can actually engage with carrier and look into that stuff for you. So again, if you would like, please give me a call, 360-846-8200. Talk to you soon. Goodbye.